Well, in Australia, having fun in the water is accepted, even celebrated, as something you do from a very young age. But there remains a tragic side. Last year, 33 children under the age of 5 drowned in Australia. Well, in Asia, it's estimated that about 300,000 children drown annually. Well, organisations in the region and globally are trying to do something about that figure and the enormity of that accumulated tragedy. The World Conference on Drowning Prevention was recently held in Vietnam, and among those attending was Justin Scarr, the Chief Operating Officer of Royal Lifesaving Society Australia, and he joins me now in the studio. Justin, thanks so much for your time tonight.
Good evening.
That figure, 300,000, when you heard that was the estimate for how many kids drown in Asia annually, for a life-saving practitioner such as yourself, how much did that shock even you?
Yeah, it was absolutely staggering, and we worked very hard to bring that Australian figure of 33 young children drowning every year down. But to sit in a meeting with some researchers who'd picked up on research from a number of countries and suggesting that the burden was that great, that's 40 or 50 times what's suffered by Australian families. And from the Royal Lifesaving perspective, we had to act very quickly.
Which countries are the most affected by drownings, and which socio-economic groups within those countries?
Yeah, the groups that we're looking at the moment is predominantly around the Mekong region. So we've got Vietnam, Cambodia. There is very strong evidence to suggest that drowning is a leading killer of children between the ages of 1 and 4. And then all the way down in the South Asian context. So a country like Bangladesh, with a population, a very large population, and also a very large population in that young age group, and a population that's very exposed to waterways in and around the rural location. They're by and large living in farms. There is water literally everywhere. There's more water in Bangladesh in sometimes than there is land. So we're talking about irrigation channels, rice fields, but also the ponds that are used for daily cooking and bathing.
What has been the level of awareness of water safety and preventing drowning in these countries that you've looked at?
Initially, the communities that we're working in were surveyed, and they were asked about drowning, about the preventability of drowning, and many of them said that it was inevitable. It was actually part of life. It was something that they had accepted for many, many generations. So the work of our partners, the Alliance for Safe Children and many others, when we go into communities, we talk about how we prevent drowning in Australia, and we also talk about local strategies and activities, and that culture gets turned around reasonably quickly.
Let's look at one example of that. The conference heard that measures implemented by your organisation, Swim and Survive program in Bangladesh, have had an effect. Tell us about that.
It's a fantastic story, something that Australians have been doing for generations. The swimming and water safety program, Swim and Survive, initially through vacation programs, but now down at the local swim school. We took a program similar to that to the Bangladeshi community. Of course, there's no swimming pools, there's no instructors, there's no community awareness. We literally had to start from scratch. And so working with them, building a program very similar, recruiting local people at a community level, so not necessarily sending Australians into the backwaters of Bangladesh to teach Bangladeshi children, but truly building local capacity to manage programs and deliver swimming and water safety programs. And the research now, after 4 years of careful monitoring of that, has found that it's reduced drowning by 85% in those communities in school-aged children. But the program that's having a bigger impact is actually something as simple as the humble creche or preschool. The research shows that children drown predominantly between the ages of 1 and 2 and 3, and between the hours of 9 and 1 in the morning. So actually putting them in a safe environment like a preschool in their own community has actually had a dramatic effect on reducing drowning in those very young lives, where we can't really teach swimming and water safety directly to them.
You described some of the measures there in Bangladesh, but generally, just how difficult is it to apply tried and true practices in a developed country and then plonking them in a developing country in order to save lives?
Yeah, look, this is development, and it's sustainable development. It's not trade. So it's not essentially us exporting our programs directly into those countries. Really the great success that we've had is building local capacity. Now that's the capacity of the researchers, the program managers, or Bangladeshis or Vietnamese. As an example, in Vietnam, we've taken the experience in Bangladesh and we moved it into Vietnam, and there the Vietnamese parents said, we're not teaching our children to swim in ponds. What we need is some clean water, and so we've had to use portable swimming pools. Very, very expensive to build a brand new swimming pool, so there the community said, no, we'd like to use primary school teachers, and we'd like to have those pools constructed in our school environment, and we'd like you to help build our local capacity to teach swimming and water safety. So it's not a case of trade, it's actually sustainable development, and that's really the only way that drowning prevention or the issues of drowning are going to be taken seriously by the development community.
Doing it at the grassroots level is one thing. How do you get authorities on side, governmental authorities, to also provide legislative, be it laws to say, no, we have to tighten this up, and to provide money to try and help out at the grassroots level? Yeah,
certainly the research is critical to that. After 4 years now, 4 years ago we were knocking on the door of AusAid and we were talking about this research that's showing that drowning was a problem. But to go and talk to AusAid, the Australian government, but also to UNICEF and WHO, and show the data that now shows that it's preventable. We're seeing early situations in Vietnam where the government itself has initiated some policy on child drowning prevention and child swimming and survival lessons at a school. So there's some work at a policy level, but the critical thing is to build partnerships at this point, and that was the purpose of the World Conference on Drowning Prevention. We had over 400 people from 50 countries, but importantly many of the people at that conference were coming from the low and middle income countries that are suffering the greatest burden of drowning, and building partnerships at that level hopefully will raise the profile of the issue, but also to start building a platform to reduce drowning. Probably initially in Asia, where we're very fond of Asia, we're very close to Asia. Australian skills can be put to good use in our backyard, in our neighbourhood, but ultimately we're hopeful of influencing a global strategy to reduce drowning in many other areas, including Africa and the Pacific.
How great a problem is it, for example, in Africa and in the Pacific? Do you have statistics for there?
No, the statistics are very, very difficult to get from those two regions. One of the big lessons from Asia was, in fact, that hospital data, which is really the data that's the driver for many of the public health decisions that are made in our aid program, in other aid programs, is not a very good way of mapping drowning. Children who don't drown in hospitals, we know that from our own experience in Australia, death is almost immediate. And so if you're a poor child in regional, rural Africa and you drown, chances are you just don't get counted. So the standard health approaches to counting deaths and mortality and mobility don't necessarily work in the context of drowning. So unfortunately in Africa we've got some information that says it's as big a problem as it is in Asia, and certainly the Pacific we think that it may be a problem there, but we need to start at the point of actually building partnerships, initiating research, and then looking at whether the lessons from Asia do actually apply to island communities in the Pacific or areas of Africa.
Justin Scarr from the Royal Life Saving Society Australia, thanks so much for your time tonight and filling us in on that.
Right, thank you.